Hi everyone, my name is Dr. Samara Rashid, and I will be talking about the professional dental assistant, and that comes from Chapter 2 from the Modern Dental Assisting textbook, the 13th edition, by authors Bird and Robinson. Characteristics of a professional dental assistant. Professionalism is key when you're practicing dentistry as a dental assistant. Professionalism deals with an apparent attitude in everything you do and say. No matter what, a dental assistant must always express patience, be compassionate, and be professional with all patients and even your colleagues. This also deals with your coworkers and the staff that you work with. Remember, there's a difference between those who have a job versus those who pursue a career. On the side, you'll see a picture of a dental assistant working with a dental provider. And these images in this lecture all come from the Bird and Robinson textbook of the 13th edition. Professional appearance of a dental assistant include good health, good grooming, and of course, the appropriate dress. Exposure of the arms are not acceptable. Exposure of certain parts of the skin are not acceptable because it ensures safety of the dental assistant. Knowledge and skills. Dental assistants should ideally have both front desk and chairside skills. Front desk skills mostly deal with the business aspect of the clinic, and chairside skills mostly deal with the clinical aspect of the clinic themselves. No matter what, when it comes to dental assisting, we have to believe in something called teamwork, because together everyone accomplishes more, okay? Each letter becomes a team. And being a dental assistant, the job itself entails being multifunctional, especially in the absence of other staff members. So if a dental assistant has proper training or is very experienced in the front desk aspect or the business aspect of the dental clinic, if the front desk person is absent for that one specific day on a regular schedule, the dental assistant can actually be multifunctional in a sense that they can work the front desk while being in the back, or just plain and simple working the front desk. Attitude is very important. You know, as a dental assistant, it's very important to show willingness to get along with others. And it's very, very good practice to avoid gossip and criticism of others. Being involved with gossip and criticism of others makes you get involved in other unimportant factors. Dedication, it's only possible only if the dental assistant truly cares for people. You have to be empathetic to their needs, and you have to maintain a positive attitude. Some other characteristics of a professional dental assistant entail being responsible and also taking initiative. And those can be demonstrated by arriving on time, staying for the full shift, being a cooperative team member, and not asking to leave early. Many times there are dental assistants or staff members that come to the clinic or come to the office and say, I need to leave early. You know, of course, there are instances, emergencies do happen, but if you can give early indication as much as possible, such that the office or the clinic can go ahead and accommodate the schedule so that no one can have their time wasted. Confidentiality is extremely key. Everything that is said and done in the office must remain confidential or must remain in that office. There is something called HIPAA, and that is called the Health Insurance Portability and Accountability Act. It consists of federally privacy laws. It helps to protect the privacy of the patients. There are times when HIPAA laws are violated and patients have been known, or there have been cases where patients have pressed charges or used the law to punish the dental clinic for doing such a matter. Personal qualities as well. The dental assistant must demonstrate sensitivity to the patient's needs, show empathy, and say the right thing at the right time. And most of all, be sincere. So educational requirements, let's talk a little bit about that. Dental assistants can receive their formal education through various types of programs. Most academic programs require 8 to 11 months to complete. And after the 8 to 11 months, you're basically done. Some of the career opportunities that are present are a multitude for the dental assistant. Many dentists employ 2 or more dental assistants. The types of practice settings that dental assistants can pursue to work in could be just a plain and simple solo practice, or even a group practice, specialty practices. They can go on to be office managers. They can also be financial coordinators. They can be scheduling coordinators. Public health dentistry is another key factor. Hospital dental clinics and dental school clinics as well. The salary, of course, depends primarily on the skills and abilities of the individual and the responsibilities associated with the specific position. Let's talk a little bit about their professional organizations. One key one for dental assistants is the American Dental Assistants Association. It represents the profession of dental assisting, and it's represented or abbreviated as the ADAA. It was formed in 1924 by Juliet Southard, and you'll see a picture of her here to the right, which is taken directly from your book as well. It is a national nonprofit organization, and the benefits of being a member is a tripartite membership. So you are a member of 3 organizations. The benefits of the membership is a tripartite membership. And basically, when you have this tripartite aspect, the member is also a member of the state component, a local component, and the national organization. Basically, being a part of the ADAA allows the member to grow personally and professionally. There's a couple of benefits to it. Also, that you become current on issues and current information. You have an automatic subscription to the magazine or the journal, The Dental Assistant. Also, there's some offers of professional liability, awards and scholarships. You're also made more aware of the availability for those enrolled in training programs. And overall, you have enhanced people skills, and it teaches leadership as well. I took this one specific picture. Please excuse how it looks. It comes directly from your textbook. It's just the many roles of dental assistants. We can sit here and talk about it, and it'll take us hours, but it's just really important. I wanted to just cut and paste it, and you'll see that it breaks it down into chair-side dental assistants, expanded function dental assistants, and the roles of the administrative dental assistant. Go ahead and look at that at your own time. Make friends with it. Make sure you're aware, just overall, about what each one does, because it will come in handy. Okay, this is the seal of the American Dental Assistants Association, the ADAA. Again, another couple of pictures or cutouts I took directly from your textbook. Basically, there's a check for your personal qualities as a dental assistant, kind of like a self-assessment to the left. And to the right, it's basically a mission statement of what the ADAA proposes, okay? And it tries to advance the careers of dental assistants and promote the profession in a matter of education, legislation, credentialing, the activities that enhance the delivery of overall dental health care to the public. And you can obtain more information from the ADAA at this site right down here, www.dentalassistant.org. They also have a phone number, and they have their address as well. One of the key points that I'm sure you guys have heard from before is the Dental Assisting National Board. I wanted to include this organization because it's very, very important. It's going to follow you throughout this entire program, and if anything, even when you graduate. The DANB is responsible for testing dental assistants and issuing the credentialing of certified dental assistants, or the CDA. It's recognized as the National Certification Agency for Dental Assistants, and the certification of DANB is voluntary. It's not mandatory to be DANB certified in all the states. Some require the CDA to legally perform specific expanded functions, so that gets even more detailed. But when there's DANB certification, it promotes professionalism and commitment to excellence. So it shows a lot about the program and about the student when there's DANB certification. Also, it offers a state-specific dental assisting expanded function examinations as well. So there may be more exams than just this. The Certified Dental Assistant, or abbreviated as CDA, could be learned through specific eligibility requirements stated by DANB. Now you can go through pathway 1, pathway 2, or 3. It's totally up to the individual. In pathway 1, excuse me. So you can go through pathway 1, pathway 2, or pathway 3. In pathway 1, there's graduation from a CODA accredited dental assisting or dental hygiene program. And you have to have your current CPR from a DANB accepted provider. In pathway 2, you can have your high school graduation or your equivalent, a minimum of 3,500 hours approved of work experience. And you can have your current CPR from a DANB accepted provider. In pathway 3, you can have your former DANB CDA status from before, or you can be a graduate from the CODA accredited DDS or DMD program, or a graduation from a dental degree program outside the USA or Canada. And you must have your current CPR from your DANB accepted provider. Okay, some of the benefits of DANB certification are listed on your left, and it's for some of the benefits of DANB certification for your patient it provides assurance that the dental assistant has the necessary knowledge and skills. It strengthens a patient's confidence in the dental team, enhances the assistant's reputation, provides a level of professionalism, and the CDAs stay in the field nearly 3 times as long as a non-certified dental assistant. For the dentist or the dentist employer, the certification provides a sense of personal achievement, promotes the dental assistant's professional pride, and it demonstrates a commitment to excellence and lifelong learning. For the dental assistant, for the dental assistants for themselves, the certification provides a sense of personal achievement, professional pride, a commitment to excellence, lifelong learning, greater earning power, and job satisfaction. So dental assistants with the DANB certifications, they earn nearly $2 more per hour than those who are not certified. So it's a pretty big deal. And it provides career advancement because DANB is recognized or required by 39 states, the DC, the US Air Force, and the Department of Veteran Affairs. So, you know, it does give you enrichment. It does show a lot about the reputation of your degree, of what kind of education you were exposed to as well. And to the right, of course, there's the official DANB CDA pin and how the design looks. Again, the DANB is the national certification board that's responsible for testing dental assistants and issuing the credential of the CDA. And it consists of 3 parts. So this gets into a little bit more detail. It consists of 3 parts, which can be taken individually or all at one time. You have the radiation part, the X-ray part, radiation, health, and safety. And then you have the infection control and the general chairside assisting. Again, when it comes to radiation, that's one of the key ones from what I remember is a little bit more challenging, only because it's a little detail oriented. And in this program, you take the radiation or radiology, you take early in the program. So it's really important to stay up to date with that detail such that you don't forget all the details or information that you have learned when it comes time to taking the DANB. There are other certification exams. There's the Certified Dental Practice Management Assistant, or the COPMA. There's the COA, which is the Certified Orthodontic Assistant, and also Certified Preventive Functions Dental Assistant, and the Certified Restorative Functions Dental Assistant, CRFDA. There's a slew of them. There's quite a number. And we can go on, and you can get even more and more specific. But it's important to know what's out there, what your options are, or what your options will be. So the exam can be taken in 3 ways. You can take all 3 components, okay? I believe the radiology, infection control, and the chairside. I believe the chairside, is that what I said? Yeah, the general chairside assisting. Sorry for all the abbreviations. But you could take all 3 components, okay? Or you can take the radiology and infection control ICE together and then take the chairside assisting, okay? And you can take and pass individual exams within a 5-year period to earn certification. Now you can take all the time you want within the 5-year period. The only thing, again, what I said before, is that when it comes to the detail, you will forget with time. So it's very, very important, very stressed that students take it as soon as, excuse me, as soon as they're done with taking a specific a class, especially radiology, since it is so detail oriented and it's very easily forgotten. Again, the exam can be taken in 3 ways, which I said before. I think this is more of a repeat, but this slide just basically has the official logo to the right of the Dental Assisting National Board, okay? So there are no eligibility requirements for taking the radiology and the infection control exams. After you pass radiology or RHS and the infection control ICE, the candidate receives a certificate of knowledge for competency. The radiology or radiation health safety exam is recognized or required in 21 states and the District of Columbia to meet the radiography requirements. The CDA exam is recognized or required in 31 states and the DC area for either radiography or even expanded functions. Currently, 38 states overall recognize or require DANB, the DANB exams for dental assisting practice. So, I mean, wherever you go, you don't know where you're headed. You don't know what your life will be. I cannot stress I cannot stress anymore that students should take the DANB exam because it's just, it really, you don't have to worry about it later, okay? Because remember, if you go over a certain time frame, you're not going to remember what you learned in the past. And then it's also expensive. I believe it's around, I think, a total of $400, if I'm not mistaken. But it costs money, and you don't want to be wasting money if you fail or if you don't pass. Then, of course, there's maintaining the DANB certification. There's a minimum of 12 hours of continuing dental education per year. If the DANB certification is not maintained, you may have to retake the DANB exam. Okay, and that's something that you don't want to do. Again, for more information and application for the Dental Assisting National Board exam, go to www.danb.org. And again, your book mentions where to obtain more information in regards to DANB with the Dental Assisting National Board and its address and its phone number. Thank you so much.